11th SA Aids Conference officially kicking off in the next 20 minutes or so at the Chief Luthuli Convention Centre in eThekwini. It brings together HIV community, including scientists, researchers, activists, program implementers, policy makers, and of course people living with HIV to look at the progress made towards dealing with the HIV and TB pandemics in the midst of all of the other global health problems that we face. Nobuhle Modise is our reporter there. Nobuhle, good afternoon to you. What's expected to happen there?
Yes, I can hear you.
Good afternoon to you. What are we expecting to happen there today?
So, Stephen, this is actually the first in-person conference post the COVID-19 pandemic. The last in-person conference that was had was in 2019. Following that, the next one was in 2021, which was a virtual one. Now, today, as you've mentioned in the intro, it brings together different, people in the spheres of HIV, including civil society organizations, people living with HIV/AIDS, government as well as civil society organizations, just coming together to take stock of what progress needs to be done or what progress has been made since the COVID-19 pandemic. Now you know that UNAIDS had a goal set for 2030 that at the end of 2030 they would have ended the HIV/AIDS epidemic, but now that goal has been derailed according to the UNAIDS by the COVID-19 pandemic, and that's obviously due to the fact that people who are on treatment didn't have access to clinics, for example, to get their treatment. But if you zoom it in to KwaZulu-Natal, I mean, South Africa as a whole has one of the largest burdens. It's got a 14% prevalence of HIV/AIDS, and when you zoom into the KwaZulu-Natal province, it's got its own burden. It's the highest in the country with the highest cases of HIV and AIDS. And if you zoom into the province and deal with the issues there, outside of what UNAIDS is saying, being the COVID-19 pandemic, the province has suffered a lot of other tragedies too. You will remember the 2021 July riots as well, as the April 2022 floods. And if you visit areas in and around the province, the rural areas to townships, and you speak to people who are living with the virus and activists as well as health workers, there are also a lot of other, factors that challenge them when it comes to treatment, getting their treatment. You'll find a lot of them defaulting because, like I said, we had those riots, we had the April flooding, but on top of that, there's also socio-economic issues where you can't take your medication on an empty stomach, so poverty also plays a role. But I want to bring in some members of civil society organizations as well as government. I'm going to first speak to Mr. Thabiso Mokoena, who is from Love Life. He's the national manager for healthy lifestyles at Love Life, and I want to speak about their role here today at the conference. Thank you very much, Mr. Mokoena, for joining us. Just speak to us about your role here at the AIDS conference today.
Thank you, Nobuhle. We are here to elevate the voices of young people that continuously communicate to government and civil society that we must have access to services, health services, and it must be done in a dignified manner as it's provided to them. And actually services must be brought where young people are. And we are here to elevate their voice. We are here as well to indicate to South Africans and the world that is here to say this has been our contribution over a number of years in ensuring that the information levels around the issues of HIV, health promotion, and supporting government efforts to reach the UN goals, 90 at first and now 95, to ensure that we form part of important contributors into reaching those goals, but we do not have young people left behind in ensuring that they are the main beneficiaries of these services. And that's basically one of the reasons we are here.
I mean, you would have heard me say earlier when I was speaking to Steve and speaking to the fact that the UN says that it has a goal. You know, you've mentioned the goal for 2030 to end the epidemic, but then the COVID-19 pandemic derailed that. Now, according to you, do you believe that that's solely the issue? I mean, in KwaZulu-Natal, as I mentioned, I mean, there's the biggest burden here in KwaZulu-Natal throughout the country, and here there are other issues, you know, outside of just the COVID-19 pandemic that I had mentioned, like the riots that happened in 2021, as well as the flooding and socioeconomic issues as well. Poverty also plays a huge role. Now, do you think that that goal will be reached when we still have such issues that plague the society, especially a society where it holds the biggest burden of HIV/AIDS cases?
COVID-19 was a huge disturbance, and really in the country and elsewhere disturbed a number of programs, including access to services, like I indicated. If you look at the researches that were issued around about the second quarter of 2019, amongst other things that were indicated was that some of the clinics were closed in the beginning of the pandemic, and access to medication was an issue, access to contraception was an issue. Thus, you'd have the usage of condoms as well going down as a result of failure for young people to access such issues. And clearly the goal was impacted negatively by COVID-19, understandably, because of how, especially in the first quarters, when the COVID-19 became a reality in the world, how it was approached, the lockdowns, and how it was handled might have not only affected our country, but the world in general. However, I don't think all is lost. We should be able to, as civil society, government and the UN, continue the journey towards ending the pandemic through all the efforts that should be invested in ensuring that the services are reaching the people. But if you look at Africa and our country in particular, the struggle is not the same. If you indicated earlier on that there's poverty, we are experiencing one of the highest unemployment rate, especially for young people in the country. So you do not employ the same mechanisms as the first world countries would employ in addressing and going towards achieving the goal. So you have young people in this province who are still affected by the remnants of the floods that you were talking about earlier on, who have not seen the benefits. I think not so long ago, AG was indicating that there's a very low percentage of the budget that was provided to assist the KZN people to benefit from such, which then limit their benefit from such. And as a result, you have such things impacting the processes and the interventions that are put in place for the goal to be reached. But that is a goal that should be reached, and young people should not be left behind, and the civil society as well as government and other institutions must join hands to ensure that we end the pandemic, and we are prepared as Love Life and always on board to contribute towards that.
Thank you very much. That is Thabiso Mokoena, who is the National Manager for Love Life, and he's just speaking about the goals, confident that that goal will be reached in 2030. I also did want to bring in government, but unfortunately we've run out of time, but he's just summed up what their role is going to be here at Love Life, and you can see that behind me the program is going to kick off. It is supposed to start at about 3:30. We were expecting Deputy President Paul Mashadile to be the one to open the conference, but unfortunately that won't happen anymore, but he will be represented by the Minister of Health, Dr. Joe Phaahla.
Nobuhle Modise, thank you very much indeed. The choir warming up there as well. We do expect that event to start literally in the next 10 minutes or so. In deep